Thank you, Deputies. Now we move to Leaders' Questions, and I call on Deputy MaryLouMcDonald. Thank you, Deputy.
Housing delivery is the #1 priority for this government. That's the opening line of the statement issued by yourself and the Taoiseach following the first meeting of the Cabinet Committee on Housing. From this meeting, you had promised a slate of new and dynamic ideas, you said, to tackle the housing crisis, but that has not materialised. In fact, you've brought nothing new at all. The truth is, Taoiseach, that your housing plan is in free fall. After your figure of 40,000 new homes for 2024 was discovered to be a work of fiction. So now you have this scattered, frantic, directionless approach where the government is talking about everything but dealing with nothing. Just to remind you, we still have sky-high house prices. The CSO tell us 200,000 euros more expensive now than a decade ago. We still have rip-off rents, shocking levels of homelessness, and today a report reveals the extent to which international students are being pressurised for sex in return for rent-free housing, surely a new low. You propose to end the rent pressure zones. You propose to reintroduce tax breaks for developers, but you give nothing on how government is going to deliver homes that working people can actually afford to buy or rent. After all the high-level meetings, your big centrepiece idea, it seems, is to relax planning rules to allow people to build cabins in the bottom of their gardens. Now, greater flexibility is needed in this, and we will work with the Minister to get the regulations in place. But to cast this up as the solution to the housing crisis simply highlights just how broken and how failed your response to the housing crisis is. Tinkering around at the edges doesn't cut it, Taoiseach. We need a serious change of direction in housing policy, one in which the housing needs of ordinary people is prioritised and where affordability is tackled head-on. In O'Devney Gardens, now called Montpellier, here in Dublin, the largest government so-called affordable housing scheme in the state, we read this morning that a two-bedroom apartment in the development can cost anything up to 402,000 euros. That's not affordable, Taoiseach. It's certainly not the cost we should be getting from a government subsidised housing scheme. This was, remember, public land on which the state could have developed genuinely affordable homes. But instead, government forced Dublin City Council to hand it over to a private developer, and now we have these prices that are out of reach for the vast majority of working people. Taoiseach, you have stated that everything is on the table when it comes to housing. But in reality, this is code for not having a clue what to do next. Your so-called new government has no new ideas and no coherent plan. Tá de phlean tuithíochta ina phraseach, mar sin tá de chur chuige trina chéile, níl túram nó freagra nó ar bith an rialtas seo tá an anam is a bheith nua Maria. Taoiseach, this government is all over the place on housing. The big question now is, when will you get your act together? When will you bring forward new ideas and solutions to this crisis?
Well, at this point, we're all Slair ó fithe amach go bhfuil dul chun cín le feiscint ó thaobh cuasaí tuithíochta. Tá na cuid déanta going agus léir mar aon lei sin nach bhfuil go leor déanta ar a dóthain de déanta going agus tá bhfad níos mó le déanamh sna míana agus sna blianta atá roing. Ach an tóir antá gom héin ná go bhfuil an policy atá ag an rialtas seo a bhfad níos fearr agus beic sé a bhfad níos ifiachtach den na polisithe atá fáiltethe ag sin féin. Agus níl aon áras orm fí sin. Just want to say at the outset that the Since 2020 onwards, there has been progress in relation to housing. And we went from 20,000 a year to over 30,000 a year. We exceeded the targets that were set in Housing for All, which were realistic targets taking variable factors into account. But given the rise in Irish population and the growth of our country, it's not enough, and I acknowledge that. And housing is the #1 issue facing us. And we have introduced a range of schemes. The last government did. This government, only a number of weeks in office, has announced about 450 million additional funding for social, affordable and cost rental homes. We're setting up a new strategic initiative office, housing initiative office, as recommended by the Housing Commission. We're publishing the National Planning Framework to allow us to zone much more land and to enable the county councils and the city councils to zone additional land for more houses to be built. So we are hitting the ground running in relation to the housing agenda. And if I contrast with your position, and I acknowledge all the challenges and the pricing and so on like that, but the bottom line is that our schemes have helped an enormous amount of first-time buyers. The Help to Buy scheme has been about 51,000 approvals. So that's 51,000 approvals. You opposed it, and you proposed to abolish it. The First Home scheme, likewise. Over 3,000 homes have been bought by young couples or young individuals using the First Home scheme. You proposed to abolish that. And that's, I believe, why the people were not persuaded by your housing policy platform. And then you had a convoluted idea under affordable housing that people could buy the house, but they couldn't buy the land on which the house was built. And you would dictate how they would sell the house subsequently, which appealed to nobody out there in respect of young people looking to buy a house for the future. And those are the facts, and people made decisions based on that. But that doesn't get away from the need to get to 50,000 houses per annum, as the ESRI are indicating is required given our population growth. And the focus has to be on initiatives that make that happen. You mentioned O'Devany Gardens. I accept those prices are high, but they're being heavily subsidised as it is by the state. Heavily subsidised. So you can't have it both ways, Deputy. The entire intervention in housing at the moment, this is repeated now happening at Cian Corla, repeated heckling and interventions by Sinn Féin every time I speak on leaders' questions. And that sort of intimidatory tactics and attempts to disrupt must be stopped. Well, I'm just making a point, and I'm not going to take it and without making the point. Please. Because Deputy O'Brien seems to either aspiring to be the leader of Sinn Féin or what, I don't know. But he's constantly interrupting on these matters. But could I say that we do, in terms of other initiatives that we will be taking, and we outlined those yesterday in the aftermath of the Cabinet Subcommittee on Housing, which is
Taoiseach, I can only surmise that you wish to deflect and comment on Sinn Féin's policies because you know you've been caught out, like you've been found out, right? You spoofed during the election campaign. You presented a work of fiction, kind of fact flexibility from Fianna Fáil. What a novel thing, not. And now you're in the hot seat again and there's an expectation of delivery. And you are showing no serious intent, much less any capacity, to actually deliver the affordable homes that working people require at scale. No interest really in taming runaway rents, far from it. You're quite happy to listen to your lobbyist friends, all of your old party political mates who now find themselves in other places of influence. You've missed social and affordable housing targets every single year on your watch. And the typical home, as I told you, is 200 grand more expensive than over a decade ago. You claim progress, but the Residential Property Price Index demonstrates that prices are up by 8.7% in the last 12 months. So you're failing, Taoiseach. Why don't you just stand up and accept that fact?
Please.
First of all, the difference in our policy platforms on housing are clear. And I think you would do away with supports for first-time buyers. We're going to double down and continue our supports for first-time buyers in particular. And we have, in the first weeks of this government, substantially now increased allocations for social, affordable and cost rental an additional 450 million. And now the big issue facing the country is outturn. We're at the beginning of this year. We're not misleading anybody, Deputy. Is this going to be a constant?
Deputy, please stop interrupting.
Deputy O'Brien, I have heard your leader
Deputy,
speak to
it's
the
your
chair.
leader asking the question. Allow the Taoiseach to speak. Thank you. Thank you.
This is
Taoiseach.
a constant behavioural tactic of Sinn Féin to prevent the government side of the House to at least present its position.
When the time is up, the time
The
is
main
up.
point I was going to make is this. There are a number of options facing us. We do have to get the private sector involved, much more, and as we know from all the lobbyists that you met, Deputy O'Brien. But also, I take the point that was made earlier in respect of public
Thank you, Taoiseach.
expenditure.
Your time is up.
We do need to continue
We move
to
now to
increase
Deputy
public
Ivana
expenditure on
Bacik,
housing.
Labour Party.
And
Thank you,
we have to
Taoiseach.
try and do both.
Thank
Whether
you,
it's a tax
Taoiseach.
expenditure, well, this
Time is up, Taoiseach.
this is
Thank
not
you.
satisfactory,
Deputy
Cian
Ivana
Paula.
Bacik of the
It's not
Labour Party. Thank you, Deputy. Deputy Ivana Bacik.
Garmagat Can Corla Taoiseach. This winter has set yet more alarming new records for people on trolleys in our emergency departments. And that means more people whose care may be compromised because there's no space for them or no one to admit them. It means more risks for patients' conditions to worsen in a place where they should expect to improve. Taoiseach, I welcome the new efforts by the Minister for Health announced to tackle overcrowding, and these are long overdue. In yesterday's press release from her department, she identified 2 issues exacerbating the problem. The first, she said, is the ongoing lack of capacity in hospitals, and the second, she tells us, is the increased numbers of people on trolleys over weekends and on bank holidays due to lower discharge rates. And she spoke strongly on the radio about this earlier today. Now, these are serious issues, but Taoiseach, the single largest problem in reality is the continued chronic shortage of healthcare staff, of nursing staff, of support staff, of medical staff. The continued pause on recruitment is having a real and serious impact on healthcare in our communities and our hospitals. And everyone knows this. Anyone who's recently visited a hospital knows this. So it's not just our view in the Labour Party. Last week, the Irish Nurses and Midwives Organisation released their first Behind the Trolley Numbers survey, conducted by nurses working in acute hospitals, treating patients on trolleys and hospital corridors. The real-world experience of those on the coalface of the crisis. And their view is overwhelming. When it comes to ending overcrowding, 83% identified bed capacity and 80% said recruiting more staff was key to addressing the issue. So, Taoiseach, when it comes to building hospital capacity, clearly there are a great many measures that must be taken. And some of these have been announced, in fairness, by the Minister. And we would welcome these. Measures like digitising health records, long overdue. New methods to increase productivity. Forward planning in advance of weekends that we know will place more strain on the system. But, Taoiseach, ultimately, these measures will come to nothing until your government acts to recruit more healthcare workers and until you introduce ways to improve conditions for staff who are already there so that we have better retention rates, because staff do not feel they're being treated with respect. We have an ageing population, we have more complex needs than before, and demand for emergency care has increased. But that's no excuse for outrageous gaps and delays in the system. Last week I raised the case of an elderly woman in my constituency left waiting 3 hours for an ambulance to take her 10 minutes up the road to a hospital. And I've received contact from so many other paramedics and ambulance workers since then about the care they provide being compromised by staff shortages. So, Taoiseach, when will we hear more about the new healthcare plan, specifically on staffing and working conditions? And crucially, when will your government act to carry out the necessary recruitment drive to ensure that we have enough staff working in our healthcare system?
Thank you, Deputy Taoiseach.
Well, dús páide a bhíonn go bhfuil brú na seirfisí ag an dála agus go háir na hospidéal agus bhí sé sin le feiscint deir seachtainna níomh bríd. Níl sé sásúil agus tá sé sin ráite ag an áras sláinte. Just want to say at the outset, I acknowledge first of all the very significant challenges facing emergency departments, particularly over St. Bridget's weekend, and the pressure on people and the distress that that causes to people waiting long hours in our emergency departments. But I do think that the overcrowding at St. Bridget's bank holiday weekend, and I think the Minister is right to highlight this, was directly linked to low weekend discharges and subsequent high numbers on trolleys. Now, this has been an issue for quite some time. The introduction of the public contract only and that's a very significant development that was achieved last year. But that was very much linked to a changing roster arrangement and deployment of senior decision makers in our hospitals to give weekend coverage. I mean, historically in the Irish Public Health Service, weekends are the worst time to be admitted to a hospital. So the House needs to engage with that. There has been enormous investment in health in the last 5 years, by any standard, both in recruitment and also in terms of infrastructure. And there needs to be more. We also need, parallel with that investment, to analyse forensically the deployment of people with a view to getting the optimal outcome for patients and for people who attend our hospitals. We have wonderful people working in our hospitals, but we've long said it can't be a 5-day, it has to be rostering of senior decision makers to enable better discharge, and that we don't get this weekend, particularly bank holiday weekends, which has been a feature. Now, there's been some successes on that front. Some hospitals like Waterford, Tullamore and Connolly, for example, had 0 or low trolley numbers as well. So there is a management issue as well of resources, and we need an increase in resources. And we've been recruiting extensively, and funding has been allocated for further recruitment of staff this year, particularly medical staff, nursing, allied healthcare professionals in particular. And I think these are issues we need to discuss and engage with hospital managements and with representative bodies as well. Not just on its own increases and increases. We do have to analyse deployment and make sure we get the best outcomes for patients. And I think that's what the Minister has been highlighting in her comments and in the data she has received back, particularly in relation to St. Bridget's
Deputy Bacik.
weekend.
I've acknowledged there are issues, clearly, with discharge rates at weekends, and clearly there are issues with workflow and management practices. But changes in workflow and management practices are no substitute for properly addressing the real issue here, underlying the crisis in healthcare, and that is the issue of staff shortages. We're hearing from hospitals that know they need to recruit more staff, have identified gaps, have engaged in recruitment, but are not getting the go-ahead from the HSE to be able to offer the jobs. And so we hear from healthcare workers who are leaving for other countries because they are so chronically overworked due to staff shortages. And this is not just in emergency care. This is across our healthcare system. The shortage of public health nurses in the community is causing babies to miss key developmental checks, and the HSE has confirmed that it has had to scale back its service, therefore leaving children and babies at the mercy of a postcode lottery in terms of key developmental checks. So I'll ask you again, Taoiseach. When will you carry out the necessary recruitment drive? When will you end the pause on healthcare recruitment so our communities can get the healthcare that we so badly need?
To respond.
Yeah, first of all, there's ongoing recruitment. I mean, 25,000, there are now 25,000 more people working in the health service since 2020. 25,000 more. And that's in terms of nursing, in terms of consultants. The number of consultants employed in our health service has gone up 42%. 42%. And we're continuing to recruit. And there is ongoing recruit, and funding was put into the estimates for additional numbers in 2025. And yes, the attendances are also going up. Ageing population isn't putting pressure on our emergency departments. What is working best is a whole of hospital approach to emergency departments. And where that is very evident, it's producing results in a number of hospitals. And there's been analysis of certain different hospitals in terms of what's been happening within them and so on like that. So recruitment is ongoing. We're committed to further recruitment of housing staff, as well as investment in capacity and in elective facilities like surgical hubs.
We now
and the
move to Deputy Cian
well.
O'Callaghan of the Social Democrats. Thank you, Deputy.
Taoiseach, growing numbers of children and their families across Ireland are being left waiting for assessments of need well in excess of the legal timeframes that are permitted. According to the Disability Act, an assessment of need must be completed within 6 months of the date the application is received. Taoiseach, I have received new figures from the HSE which show that at the end of 2024 there were 14,221 children who are overdue an assessment of need. That's an increase of nearly 60% compared to 2023, 60% in just 12 months. Taoiseach, as you know, early intervention is absolutely key. Getting a quick assessment, followed by services and supports, means that a child can reach their full potential. According to the HSE, the average duration of the assessment period is now more than 2 years. 2 years, Taoiseach. Even when a child gets their assessment of need, they can be left waiting years for services and supports, which often never materialise. Taoiseach, the state is failing children and their families. This is creating huge stress and pressure, and this means that children are being left behind during these critical early years of their development. Taoiseach, to make matters worse, we can't even rely on these figures. In some areas, there's manipulation of waiting lists taking place. Some families have been told that their child has been put on the waiting list to then be put on a waiting list. Not only is this completely disingenuous, it adds to significant stress and pressure that families experience. Taoiseach, the situation is so bad that there are now a number of law firms who will issue a legal complaint to the HSE on a family's behalf after 3 months and initiate legal proceedings after 6 months. This typically results in the HSE providing assessment of need through contracting a private service. Families that don't go down this route are left at the back of the queue, while legal costs for the state are mounting. Instead of the state forking out money on these legal fees, would not be much better to spend the money instead on ensuring that legal timeframes are met in the first place? During the election campaign, Taoiseach, you said that the establishment of multidisciplinary teams in schools, including speech and language and occupational therapists, would be a red line issue for Fianna Fáil if you were returned to government, and you said that work on this would begin on day one. So Taoiseach, my questions are, can you tell the 14,221 children who are overdue an assessment of need and their families what this government is doing about it? When will the government meet the 6-month legal timeframe for completing the assessment of needs? And when will the multidisciplinary teams that you've promised for schools be put in place?
Thank you, Deputy Taoiseach.
Well, first of all, you're correct insofar as I did identify the provision of a school-based multidisciplinary therapy service, particularly in special schools, as a core priority of mine and a red line issue. And we are pursuing that, and I've already had meetings with my officials and will be convening a meeting with all relevant government ministers and agencies in respect of delivering on that. There were attempts in the last year of a pilot initiative on that front which did not yield the outcomes that both the HSE and the Department of Children anticipated would. And that was based on a HSE model. And I'm very clear that in the first, that's one initiative we have to take. It won't solve all of the issues. The CDNT teams are recruiting, so it's not a funding issue, but they've had challenges recruiting therapists to the model that has been created since progressing disability was introduced back in 2013, which in my opinion hasn't worked. That's why I believe passionately in a schools-based system, particularly in special schools to begin with. Also, I think we have to deal with the outcome of the 2022 High Court judgment of Ms Justice Phelan in the case of CTM and JA versus the HSE, which found that the preliminary team assessment approach described in the HSE's standing operating procedures for assessment of need did not meet the requirements of the Disability Act. I think we have to deal with that through legislation, if I'm frank, and there has to be, again, engagement if we want to move this on, because that has had a huge impact on the assessment of the need process. And I think that has to be acknowledged. There's issues around recruitment and that, but I think that ruling has operationally had a very significant impact on the situation, and we need to admit that. When I say we, collectively in the House, but it'll be politically, people may not want to deal with that. I believe we have to deal with that. As just another step in terms of changing around the situation here. We have to then increase very significantly the number of training places in our universities in terms of therapists, particularly speech and language, occupational therapists, physio, audiologists, and allied healthcare professionals. The last big initiative was taken when I was Minister for Health in 2003, when we created new colleges. At that stage, there was only one college in Ireland doing therapists, speech and language. But we need to double down on that in this era and create significant more places in our third level colleges in respect of therapists. In the interim period, the HSE, as you know, last year has been facilitating parents with private sector services and accessing private providers. I want to develop a national health-based system, in terms of the clinical assessment, and then an education system in terms of the special schools.
Taoiseach, 90% of assessment of needs are being done outside of the legal time frame now. 90%. And this is the law. It's not an optional extra for you or for the government. So I'm not clear from your answer. Is this government going to meet the legal requirements of the Disability Act? Are you going to take action so that 90% turns to 0%, so that you and your government are compliant with the law on this? Are you intending not to meet the requirements of the Disability Act? Can you be clear on that? Are you going to take action to meet the requirements of the Disability Act? Are you intending not to? Are you intending to allow the current situation to continue?
Thank you.
No, we're not prepared to allow the current situation to continue. And all focus will be on improving access to therapies for children in particular, and to turn around the entire approach to therapists from the earliest days of a child coming out of paediatric services. There's not a sufficient link up, in my view, coming out of paediatric services with follow-on services, except in some cases it won't be immediately apparent in respect of the needs of children. Some manifest later in a child's life, but there needs to be far greater synergy, in my view, between the world of paediatrics and the follow-up services and early childcare services. I also think we need to increase significantly the capacity, the context and the environment for therapists to work. There have been challenges within the CD&T teams, the way they were, in many cases the workload has been particularly onerous on quite a number of therapists, and many have left the service and they've had difficulty recruiting people.
Thank you, Taoiseach. We now move to the Independent Technical Group, Deputy Paul Gogarty.
Gur mágad Cian Corda. Agus seachtain na Gaeilge ar siúl go luath I Gogarty, Taoiseach, bhíos ag smaoineamh faoi conas sa bhfuilíonn níos mó Gaeilge a úsáid go mór idir na hÉireann nua. In Orira to 5 ann agin. Léiríonn figurí ón rúnidachas go bhfuil 8 as céad de Gogarty bunscoile sna 26 cúntaí ag freastal ar Gaelscoileanna. Agus go bhfuil 8.3 duna bunscoileanna sna 26 cúntaí ag bhaint le Gaelscoileanna. Ag léiríonn taid ón ESRI go bhfuil leibhéal an éilimh ar an Gaelscoileacht ag 23 faoin gcéad, tá níos mó duine lurg dul go dtí na Gaelscoileanna. Dúirt mé an seachtain sa chaite go gahamíd níos mó Gaelscoileanna a oscailt, tá sé seo fíor, agus na Gaelscoileanna atá agan anois, cé bheidh a hismarthirí na dáltaí a ruga in Éireann. An ceist seo, níl figurí níos deireanaí agam ach sa bhliain 2017 meas a ché go bhfuil de pointe sé faoin géid de Gogarty ar fud na bunleibhil ar fad chun Gaeilge. Titim seo go 1.6 faoin géid I munscoileanna le láin Gaeilge. So tá mé cinnte go bhfuil go leordan chuid tismarthirí ag éire go bhfeallam a fáistí Gaeilge ach níl an deis nó beidir an talamh acu leis in na dhéanamh. Tá sé deacair nuair nach é an beirle de chuid teanga gan trácht ar an Gaeilge agus mar sin caithimid fécint go nóiríre ar conas líon na nua Gaeilge na nua Éireannach a bhéadús na Gaelscoileanna. Is cinse go gceapam mór tá rinig daoine ag cur isteach ar Héireannacht Éireannach gur cheart is é mórthir marínos gur cheart go méoch siad an ann líofacht a léirú geann amháin dóir teanga go náisiúnta ar a laid. Ach freisin leibhéil réisiúnta córa I danga eile Gaeilge is dócha. Well, that's smínam. A gannám céine tá ára níos mó Gaeilge a leart I rith an lei níl me caint faoi Gaeilge lífa ach córa Gaeilge. So, tá istig fórmhar dína go bhfuil chaidán níos fearr Frankise ag dáilta manscoile thar an Gaeilge tar éis séimh líon. Cé go raibh 8 bliain acu ribh sa bhunscoil ag fáil an Gaeilge cén fá. So, ma darachas Taoiseach, cad a capan tú faoi cuasaí nuas na scoilna san airteis nó sa junior cert córa trí Gaeilge. Gur magad.
Thank you. Taoiseach.
Well, I do spart a time brecht an tachta sort an ceisio ardú agus bitter nach bhfuil is coch ach tá Lord Fáilte ag Mark Henry buinn sé leis stair na tíre ó níidir fithedó go dtí 2020 agus an méid dulcintí atá le feiscint áitina agsúla. Ceantas na figúirí a bheige ná tá bhad níos mó daoine sa lá tá nuamhán ag láirt na Gaeilge agus ag fálam na Gaeilge agus cumas na Gaeilge có ná mar a bhí sa tír seo I 2022. Agus tá cearta agat nuair a d'ireann tú go bhfuil teannachar fí le, nó go raibh teannachar fí le, ag fás agus forbas an Gaelscoíocht na figúirí sin. Sa dáil seo, tá bhad níos mó Gaelgóirí tar éis bheith tofa ná mar a bhí hena féin I mo thuairm. Sa pártaí seo, tá anna chuid daoine inis a going ina bhfuil cumas na Gaeilge acu. Agus beidir glua nuatá le tacht ar an bhód agus an Gaeling go nádúrtha acu, de bhar an béim ar níos mó Gaelscoileanna agus cláistí Lánghaeilge dara le bhéal. Ach cabid chomá chuir san áireamh go bhfuil dúilgas ar an gnábonscoil chomá an Gaeling a chothú agus béim a chuir an Gaeilge. Na mar leis na nua éireannig, I mo thuairm sé an caiigh an mion bheith ceart, caiimid gach éon éireacht a dhéanamh an Gaeling a chur a fáil dus na nua éireannig. Iad a bheile, iad takeíocht áisina a thuirtdóibh, agus mar dúirt tú héin deisina a thuirtdóibh an Gaeling a láirt go nádúrtha gan mór an béime ar an gramadíocht agus mar sin nó ar cunas na tanga. Agus tá dailh ar an scéal go bhfuil rointas na nua éireannig báil an Gaeling, tá fán áthair an Gaeling a láirt, tá gom féin nóir bhíon ag dul timpeall na tíre go dtí ag bualadh le grúpaí áirithe na nua éireannig, déanann siad iireacht an Gaeling a láirt leat agus tá sé sin sa léir. Ach in tíim leat go bhfuil níos mó le déanamh againn, agus níos mó takeíocht a chóirt. Ní hamháintas na Gaelscoileanna ach dus na bunscoileanna chomá ó thaobh an áisina agus an technolíocht a chur a fáil chun fios a chuir an scéal go háirithe sa bunscoileanna.
Gur mágad. Deputy.
Gur mágad Taoiseach, tuistigh am go bhfuil chaid an Gaeilge an bhas na gnóscoil na freisin, agus go bhfuil na daoine as na nua éireannach a lura Gaeilge a leabhart an tamar fáid freisin. Tuistigh mar seo. Is mór is cuimilm nóir bhíos méras sa cóir le cúndaí bailach lí a heas. Bhí furas cuireadh as grúpa rélig ar lá féile páric. Agus bhí siad ag conna go leor agus chan siad ar an as Berla agus as Gaeilge, agus is mór an bród a bhí ag an grúpa seo bheith éireannach agus freisin bheith as bhór tíortha nó dúrtha freisin. Chuala mé freisin an Corán a léamh trí Gaeilge. So, tá lán daoine ag lura Gaeilge leart, ach déanann an slí níos simplí. So, beidir go bhfuil ar an chaidán Gaeilge cóirde.
Gur mágad, Deputy.
A dhéanamh. Gur mágad.
Gur mágad. Sogad samúil sin, nuair a bhí tú mar méir go raibh an taithí sin a gut. agus beidir le rinse go bhfuil gá oring a bhd níos má dhéanamh ó thaobh takeíocht do chórtas na grúpaí áirithe ar fud na tíre agus a meascan pobl I gcuiteanna níos mó takeíocht do chórtaíh. Táim sásta búla leis na Gaeltachta agus ar a dachas agus an bhfuiltas I gcuiteanna conas is féidirling níos mó takeíochta a chórt dus na grúpaí den taisin a luigh tú. Chun an Gaeling a Lord agus beidir áisina a chuir a fáil dóibh. Chun bheith níos compordach, níos muínach as an Gaeling a úsáid go rialta agus go nádóra. Mar tá fón orthair, mar tuigeann siad go bhfuil nasc idir cumas ar an cumas na Gaeilge agus bheith mar nua éirnig mar a dúirt.
Gur mágad. Thank you, members. We now move to questions on promise.